In three, two, one. Hello, beautiful people. I hope you're doing okay today. It's me, Andrew, still here, still breathing, still upright, with a cup of coffee. Not bad. So, I said I'd be back. Thank you. If you watched my previous miscellaneous ramblings, which went on far too long, I said I'd be back when some stuff had happened. It's happened. Last week, it is now December the 8th, 9th, 10th. And yeah, last week was busy. Now, I don't know about you, but watching the playback on this, I am getting fed up of seeing that wall. Shall we ever change the scenery? What do you think? Right. I don't know whether this is going to work, but we'll give it a go. Oh, this is like a gas stove where the igniter doesn't work all the time. Okay, in three, two, one. No, no, no. Let's try that again. My hands are cold. I've been outside. No. That's better. Do that again. Right, in three, two, one. Well, that didn't quite go as intended. Well, this is very cosy. Could actually stay here all day. Watching the clouds roll past, surprisingly quickly. We had a named storm, I think yesterday, the day before, Storm Bram. It was a tad breezy. It was wild. We didn't even get the worst of it. North of Scotland got it. Anyway, let's try this again. Oh, blimey, it's bright. Sun's come out. Shouldn't complain. Right. Let's see if we can do this again and get it right this time. Here we go. Three, two, one. Well, that worked better. Now, apologies for the contrast. It's a bit weird. So that's my back garden. Not that you can see very much. It's not a very exciting garden, but we like it. And you are looking almost exactly due west. So we do get some absolutely gorgeous sunsets. Oh, it's fantastic. And over the fields, we get owls hooting in the night and occasionally get bats flying around, scooping up bugs out of the air. But we're very lucky, actually, very lucky. Anyway, that's not what I'm telling you. Now, the floor here, I'm working on it. It's a job I've been doing for some time. Right, Monday. What happened on Monday? I had my stitches out. Now, there's a bit of a gag on Facebook. I put the eastern seaboard of the United States on notice that if the nurse didn't have any good numbing spray, they would hear me screaming. No, of course they wouldn't. No, nurse was very good. There was a couple of little bits that had started growing in, which were a little bit stingy, but it was all right. It was fine. And a load of fishing twine came out. It was like fishing line. I'll just put a picture of that up now. And it was fine. Yeah, whatever. So that was all right. So we did that, and I didn't really feel any after effects. I got a little bit itchy actually, so a little bit of a rub, and like little dried flakes of skin that were part of the operation. It's like industrial dandruff was coming off, and that's to be expected as well. Okay, so that was Monday. Tuesday, I thought I got a day off. Not quite. So early afternoon, I get a phone call. It's the surgeon's secretary, lovely lady. She's a pleasure to talk to. And she said, Andrew, you've got post-surgical clinic on the 19th of December. Yes. Well, we've been able to bring it forward. Okay. Tomorrow afternoon. Ugh. Scary. So you'll be able to attend, will you? So, yes. So I send a WhatsApp to my wife at work. Surprise, guess what? So I got a mild amount of panic coming back in my direction. Oh, I tell you what, I'm going to have to move because this is hurting my back. I know what I'll do. And the contrast is rubbish. So I'll just pause here as BigClive.com would say, one moment, please. Oh, Tuesday afternoon, right. So we need to be at the hospital Wednesday afternoon. Okay, so we can do that. So, coffee second. Ooh, there we go. Damn fine cup of coffee. So Wednesday comes, and we troop off down to the hospital in the afternoon, 3 o'clock. Eventually get to go in to see the surgeon, and she's checking the scar and everything and how I've been. Fine, no problem. Yeah, surgically, I'm healing quite nicely. Still get little bone aches. Well, that's to be expected, I think. So in the meeting is the surgeon, lovely lady, and another guy, who I'm not going to name because I don't have permission, who's the consultant oncologist. He doesn't look old enough. And a nurse who's taking notes and doing what she's doing. So effectively, my time with the surgeon is over. We've done what we need to do. So consultant oncologist says, right, I'm going to steal Andrew now, and we'll go and discuss treatment. Steal me? That means I have the status of stolen goods. That's new. So off we go. Go into another room. And he's discussing the treatment that I'll have. Very simply, it is radiation and chemo at the same time. So the radiation is the highest power beam of X-rays that the human body can stand without permanent damage. So I'm going to become a 6-foot glow stick. Okay, that'd be nice. And then the chemo is temozolomide. I hope I've said that right. Something like that. You know what I mean, TMZ. And I take it at the same time. Well, it's not actually one drug, it's 3 drugs. And he said, we're going to start that on the 17th of December, and that'll be Monday to Friday for 6 weeks. Hang on a minute, 17th of December? Yes, Monday the 17th of December. No, I'm sorry, no, hang on a minute. I said, I have unwillingly put my family through hell. I put them in a crisis which they coped with admirably and without complaint. I want to give them a nice, relaxed family Christmas. We need normal for a while because it hasn't been. And although they're getting through it, they're coping, and they would continue to cope because we are good in a crisis. We are an effective team. They deserve better than that. So I said, unless there is an overriding clinical need to start on the 17th, then can we put it back to after Christmas, please? And he thought for a while and looked at his diary and sort of flicked through. And he said, well, we really don't like starting treatment more than 6 weeks after the operation. And if we go to 6 weeks, right on the limit, that is the 29th of December. I was like, yeah, New Year's going to be crap. Right, okay, that's fine. I'll take that. And I said, you can do anything you like to me. As long as we've had a good Christmas, I don't care what you do to me then. And he was all right with that. So that's what's going to happen. Now, everybody reacts to chemo differently. I got a wad of paperwork. What's the word? Side effects of temozolomide, an A4 sheet, any, all or none. Well, I hope it isn't all because there's some really nasty ones. But the main thing that I'm told I might well encounter is fatigue, getting used to that, and sickness. Oh, my hair falls out. Well, male pattern baldness. It's merely hastening the inevitable. So, yeah, okay, we're talking about treatment, that's fine. I said, right, I'm going to ask you the big question. How long have I got to live? There's no point messing about, beating about the bush. And of course, I'm not looking at my wife who's sat to my side. Yes, sat to that side. And I can just, she's crumbling. And I can't do anything about that. I'm not going to touch her because she will just absolutely fall apart. I'm not going to give her a hug because I know that will trigger her just absolutely falling apart. I know how she reacts. So we do the strong thing, you can fall apart at home, and that's fine. So he said 18 months. Okay, I knew that. I knew that anyway. That is a global statistical average. Everybody's different. It could be 3 months, it could be 18 months, it could be 12 years. I don't know. Nobody knows. And of course, this isn't just a one-time deal. We'll stick your head in a microwave, give you some pills. When we're done with that, thank you very much and goodbye, best of luck. No, it's not like that. It's continuing treatment. I can't remember what we're doing after that 6 weeks. I know you guys will tell me, but I've got a feeling it's 28 days off, 5 days on, and it sort of does that for I don't know how long. And then we review it, MRI. Good job there's no metalwork, otherwise I'll be spinning like a propeller in the machine. And yeah, and then. So that was that. I mean, there was a lot of other talk, but that was the relevant bits. He said, right, the next step, you need to get fitted for a radiation mask, not to prevent radiation, but to keep your head still while you're in the X-ray machine. And you won't feel the X-rays. There might be a bit of skin irritation. We'll see. Thank God it's not microwaves. I'd be boiled. I'd be boiling the bag. God, sous vide. So he said, right, we're going to do that tomorrow morning. Oh, come on, man. So Wednesday afternoon, Thursday morning. Right. So Thursday morning, 10:30 at the Cancer Centre at the Royal Stoke. Very nice building. Troop in there. Right, this chap's going to come and get you. He's the mould man, not mycological mould, but he's going to mould a thing to your face. And then you'll do this, you'll do that, blah, 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 blah. Right, okay. So Simon the mould man, he's very good. He's very good. Grabs me and off we go. We discuss what we're going to do. And the moulds, let me just, I'll show you a picture in a bit. The moulds are a very clever memory plastic. And they start as a flat sheet, you heat them up, mould it to somebody's face. If you then heat them up again, they go back flat because that's what they want to do. Okay, so anyway, I kind of got an inkling as to some of this. So he said, we put them in this water bath and they heat up and go all soft and pliable, and then we mould it to your face. I said, just out of interest, what temperature do you get to? Oh, 65 centigrade. Bloody how much? 65 centigrade. Basically, anything above 44, your face will start mechanically burning. 50, it hurts. 60, 70, your face will burn in less than a second. So 65, yeah. And I'm like, oh, hang on, that's going to burn. No, it won't. He said, because it cools down very quickly when it's out of the water bath, but still stays pliable for a while. He said, have you ever had one of those hot towel facials, maybe as part of a posh shave? Oh, yes, I have. He said, it's like that. You'll actually really like it, I hope. All right, so I got on the bed, and they have a plastic block for your head to go in on the bed, and just sort of locates it. Yeah, just to, yeah, oh, there we go. Right, I'll do that. Right, okay, that's fine. And he got the plastic sheet out, just sort of dried it off quickly, and then put it on my face. It was very nice. Oh, that was lovely. And he's sort of It's not giving me a massage, more's the pity. But he's moulding it to my face. And so my eyes, around the chin, down there. Because when you're in the microwave, you've got to be absolutely motionless, because what they're trying to do is focus X-rays to sub-millimeter precision. You cannot move, right? Now this mold has got 3 clips, one either side and one at the back. So you're clipped into the bed. You can't move. You cannot move. I mean, I was able to talk, but it sounded like a ventriloquist. Actually, I was probably the dummy. And fine, no problem. So you let it cool down for about 10 minutes. So I'm just sort of lying there, enjoying a bit of relaxation. Thank you very much. And I said to my wife, can you take some pictures? And here we are. This is what I look like. Not bad, eh? Now, some people may feel claustrophobic about that, and I get that. But years ago, I used to ride a motorbike to work. So full face helmet, I'm used to having things on my face that are like snug. And it's no more than that. So if this is something that you've got coming up, don't worry about it. It's going to be fine. Just think of it as a hot towel facial and just enjoy the fact that you get to lie down for a bit. It's all right. No, it'll be fine. I promise you. I won't tell you wrong. And it's a good thing because it's going in a positive direction. You've had all the bad stuff. Now you're getting good stuff starting to happen that will get you back to being a person. And we know, God, we know we want that. So, right, I got unclipped. I said, can I stay here? Well, you stay as long as you like, but you really need to be moving on to the next thing. Right, off we go. Out into a waiting room, another waiting room. I'm collecting them. I'm going to go for the whole set. And a couple of minutes later, a nice lady appears from a door. So, Mr. Clark, would you like to come in here, please? No, not really, but I will do. And apparently I need a CT scan. That's an old technology by today's standards. Still very effective. So I lie on this bed, another block for me head to sit in. And they put the mask on, first use. Click, click, click. I can't move. I am stuck. So I just close my eyes and just relax. And it's just like, yeah, whatever. And I go into this machine, whizzy, 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 and out I come. And 2-3 minutes, no problem. So off we go. Right. Then we're into yet another waiting room. So I've collected 1, 2, 3. I'm on my 4th today. Well, Thursday. And find a nice seat. And we just sat down and relaxed. Oh, Mr. Clark, please. Yeah. As a nurse wants me. Right. So we're doing bloods. Couldn't find any veins that worked because I was a regular blood donor. And hang on, put my coffee down. This is my left arm. It might be back to front as you're looking at it. Left arm. This is the one that they used to take out of because they tried my right arm. Couldn't find any veins. None that worked. Anyway, you can't see it now, but this, when I came out of hospital, this was purple blue because the cannula that went in, they didn't do a good job. So, bit of leakage. It's all fine. It's all gone away. So, tried to get blood out of my right arm. Didn't work. So they tried the left arm. No problem at all. Thank God for that. Otherwise, they were going to use the back of my hand. So that worked. So we did that. Then we went to see another nurse who is in charge of meds and whatever. And we had a good old chat through the meds that I'm going to take and the frequency and all that sort of thing. So I will go and get me meds. Oh, God, I'm not finishing this coffee. Right. Again, one moment, please. And we're back. Right. So this is my med sheet and schedule. So I've got 3 drugs that I'm taking. The first one is called domperidone, which is not champagne. It's very disappointing. It's an anti-sickness, and all right. So I have to take that. I'll read exactly what it says. 10 milligram domperidone. Take first thing in the morning on an empty stomach and wait half an hour before taking chemotherapy. Morning dose must be taken. Can take only if needed 3 times daily. So if it's an antiemetic. So if I'm getting the sickness thing, I can take this to combat it. Okay. Right, then, name of drug, temozolomide. I've really had to practice saying that. 140 milligrams. That sounds quite strong. Reason for taking drug, chemotherapy. Oh, okay. Take 1/2 hour after the anti-sickness tablet and then wait up to 1 hour before food or any other medication. Right. Then I can have a drink. Water. Then the next one is cotrimoxazole. 480 milligrams times 2 AM and PM. Reason for taking drug, antibiotic. Okay. Only take Monday, Wednesday, and Friday. Right. Now, so basically, I have to start with the anti-sickness an hour and a half before my breakfast. Oh, and I also have to take levetiracetam, which is an I keep wanting to say antipsychotic. No, it isn't. It's an anti-seizure med. And that I need to take as soon as I wake up. So I'm getting up about 5 o'clock at the moment. It's pretty hard work. So we'll have to see whether there's any contraindications with that lot. Hopefully not. So yeah, and then I'm off to. So okay, I've done that first thing in the morning, had breakfast, doing whatever, going about my normal day, and then we're off to Stoke to get microwaved. 10 minutes only, so it's like an hour there, an hour back. Sit down for potentially an hour because they won't just be doing me, there'll be a production line. So I'll get my measured dose of radiation with my mask, and then coat on, thank you very much, see you tomorrow. And yeah, there we go. So that's that. That's how that works as far as I know at the moment. There is the possibility of what they call patient transport services, PTS. And it's like a taxi bus. They'll just go around hoovering people up, drop them off, take them home. Picking them up is pretty good, 2 hours before your appointment. Getting home, apparently a little bit hit and miss. So we'll have to say, all right, noise is off. Don't know what's going on. We'll find out, no doubt. Oh no, it's all right. It's my son moving about. So there we go. So that's that. That's as much as I know at the moment. So that's 29th of December for 6 weeks. So 30 visits. So 40 times 30, 1,200 miles. Car's going to get, I think the car needs to go in for a service. Parking at the hospital is diabolical. When I got dropped off, my wife dropped me off for the mask fitting and everything. Then she went to park. It took her half an hour to find a parking space. It's ridiculous. Got to do something about that. Anyway, so that's that. After the 6 weeks, what happens? I don't know. I've got a feeling, to be confirmed, that it's 28 days off, 5 days on. Everybody's schedule might be different. I think that's what I'm doing, but I don't know yet. They'll tell me. There's no combination therapy on this that I'm aware of. I know certain people on the glioblastoma forum on Facebook have got all sorts of different combinations of treatment. This is what I'm told we're having here. Fine, okay, I have no issue with that. If you think that's the most effective, will give me the longest, best quality of life, I'll go with it. I don't know any different. So there we go. So that was Thursday. Right, So that is pretty. Oh, I've got to tell you that. Oh, you're gonna love. Well, I hope you're gonna love this. They say laughter is the best medicine. I had the best laugh I've had in decades yesterday. Let me show you. Again, one moment, please. I've had, we have a lot of, not a lot, but we have really good friends, and I have learned to appreciate friendship in a way that I never have before, and I apologise for what didn't happen before. Anyway, people have sent us cards. So here we have one. Wishing you, it's all mirror image, isn't it? Wishing you a speedy recovery. Yeah, oh, that's pretty good. I think I did. Just to say, it doesn't actually say anything. Just to say, well, it doesn't say anything. Nice sentiment inside. Genuinely meant too. Get well soon. No, that's not going to happen. Sorry. Sending hugs. Oh, we'll always accept a hug. Don't mind that. And this is quite nice. Get well soon. Sort of rainbowy thing. Very nice. Right. So I'm sat on the sofa where you saw me right at the start of the video. And from there, I can see outside, to the street. And I was watching a wagon route. We're in a sort of a weird Y junction. And it's confusing, but lorries get lost and come down here and have to turn around and go back out. And they always struggle. I was watching a guy struggling. It took him 10 minutes to turn around. I mean, skilled lorry driver, but it's not easy. He kept getting his turning point just slightly wrong. Anyway, I'm scanning along the windowsill. I'm seeing these cards, which you've just seen. And then there's this one. If I can turn that round so you can see it not being mirror imaged, I will do. It says, goodbye from all of us. You. I sort of looked at this for about a second, and then the irony of it hit me. And I was just laughing. I was laughing so much. I was crying for like half an hour. My ribs hurt. Oh, it was so funny. And then I was giggling like an idiot for all the rest of the day. What it is, my son Chris has just changed jobs. And this card, it's actually quite a nice card. It's like a cityscape. Was from his previous employer. They got him some really nice gifts, leaving presents, and very kind. But just the irony of, get well soon, sending hugs, just to say something nice. And then goodbye from all of us. How dare you? It's like, yeah, go on, sod off. Don't leave a mess behind you. That was so funny. Now, some people would get offended by that, but it was just like the funniest thing. It was like the most inappropriate cards you could possibly send. Oh, it was brilliant. Oh, I tell you, laughter is the best medicine. I'm cured. That was absolutely tremendous. So there we are. That was my busy week. The weekend was fine. And anyway, enough waffling from me. So thank you so much. And I'll catch up.